Okay, welcome, and let's get started. My name is Tracy Hill, and I'm a benefits communication strategist for Lumity. My role focuses on employee education for Lumity's clients during open enrollment and throughout the year. And I'm really excited about having a discussion today with Jason Cabrera, benefits manager at Flatiron Health, a healthcare technology and services company whose mission is to improve lives by learning from the experience of every cancer patient. Jason was and remains a mentor of mine when it comes to explaining the value of an HSA to employees. We first connected about a year ago while he was still at Shutterstock. Jason, welcome.
Hey, Tracy, thanks for the welcome. Hi, everybody. Like Tracy said, we've been collaborating for about a year now on how to get the message out about the value of consumer-driven health plans and health savings accounts and how they can really impact an employee population and a company's bottom line. And so I hope the hour that we have together will improve your understanding of these consumer-driven health plans and HSAs.
Great. So I'm going to share a couple of housekeeping tips, and then we'll jump right in. So first, I wanted to point out that there's a Q&A feature so that you can ask your own questions. I'll track them as we get, and we'll get to as many as we can during the HSA FAQs section. Also, I wanted to let everyone know that we'll send a follow-up email with your SHRM participation code for today's webinar. And as you can see, we have a lot of ground to cover today. We thought it would be useful to take the pulse of the room first with a quick poll. So let me set that up. So really, we're curious whether you feel HSAs are important for a healthcare strategy. So polling's open now. We'll give it just a few seconds here for folks to provide their answers. Okay, it looks like, interesting. We've got a kind of neck and neck with those that are HSA enthusiasts and those that agree. And I see that we have some doubters in the room. So let's see if we can change some minds today. So I'll jump in. I'm going to go ahead and, did we share those results? Yes. So I'm going to go ahead and jump in. So we'll start with the HSA landscape. So this health insurance graph comes from the National Health Interview Survey, which I pulled from the cdc.gov website. Data comes from persons enrolled in private insurance, which includes employer, state or federal, or private marketplace. As you can see, enrollment in high deductible health plans continues to trend upward. The dark purple bars represent those enrolled only in a high deductible health plan without a health savings account. And the light purple here shows those enrolled in a consumer-driven health plan, which they define as a high deductible health plan combined with a health savings account. So really, we're going to stick with using the term consumer-driven health plan going forward. So what are the barriers to higher HSA adoption? Well, the data here comes from Lumity's 2018 HSA survey. You're probably not surprised to see that half of the HR professionals we heard from reported a lack of employee understanding and education. But it's also worth pointing out here that a fifth also cited low or no employer contribution. And really, this is a great segue. Now I'm going to hand the mic over to Jason because he has loads of insight on how to set yourself up for success when it comes to HSAs. Jason, over to you.
Thank you. So yeah, on our first slide here, when we talk about benchmarking, there are a few things that we want to discuss. The first being your broker advisor. So understanding what the market is doing in your, whether you're kind of a general industry, whether you're looking for nationwide custom or industry-specific benchmarking can really help you understand what the real value of having a consumer-driven health plan, which is essentially a high deductible plan plus HSA, and what having that option can be to your employees and to your organization. So this will potentially result in lower premiums in general for your organization and your employees, employer FICA savings, so there's tax advantages for both the employee and the employer, and you're potentially looking at lower overall annual premium increases year over year. When we talk about a pro tip a little bit later, I'll bring this back up. industry playing a big role. So this benchmarking, as it relates to your industry, is going to help you understand what other key players in your industry are doing, which is going to help you be more competitive in the marketplace or industry specific, depending on what you're looking at. Looking at the salaries of your employees is really a big deal, in my opinion. When you look at a high deductible health plan with an HSA and then compare it to what the average salary is, or if you're looking at a whole range of salaries for your employee population, is it financially viable for everybody is a big question that you need to ask. When we then talk about funding HSAs with employer contributions and employee contributions, think about that in advance. Is it financially viable for everybody? Is there a need for potentially a lower deductible, high deductible plan, and then maybe a higher deductible, high deductible plan? That could make all the difference to some of your employees. Age and gender split can really be a factor. Like Tracy said in the previous slide, the data that was shown was for people that were under the age of 65. Looking at what the average age and gender split of your population is really important. Older populations may not see the value in building an HSA to take them into their retirement years, while younger folks are going to be either reluctant to seek care and don't want to spend hundreds or $1,000s a year on a premium for something that they're not going to really utilize. And then when you consider expanding tuition debt and other cost of living increases year over year, it may actually be more cost effective for them to spend less money on their premiums while also setting aside tax-free money for services at point of service or at point of sale, essentially, and subsequently for retirement. So those are really big deals. Next slide, if you would. So incentivizing employees. The first data point here is a little bit more geared towards the organization. Looking at your actuarial value spread between your consumer-driven health plan and your traditional copay plan. So I typically recommend anywhere between a 4 and 6% difference in the AV spread of your consumer-driven health plans and your then next cost traditional copay plan, if you even have them, or an EPO, whatever it is that you've got. So this will help you understand whether a consumer-driven health plan is going to be cost-effective for the organization. And then something to keep in mind when you're looking at that is that an employer HSA contribution is going to boost that actuarial value of that plan. So it's going to help the plan reach a higher AV value. Make your premium cost share model worthwhile. I can't stress this enough to any organization that's looking at adding a consumer-driven health plan model to their benefits offering. So many people that I've spoken to feel that consumer-driven health plans are really just another way for an employer to push cost onto them. So not just in premium, but in cost for services before the deductible is met. If you get your premium share cost model right, your consumer-driven health plan can automatically become your dollar for dollar most cost-effective plan to your employees. Next, fund your HSA accounts for your employees. So making a commitment to help them fund their accounts to offset the cost of their healthcare, either in the first year or year over year, can be a huge boost to their comfort level in adopting this kind of health plan and HSA. Not to mention, when I talk to people about CDHPs and HSAs, to me, in my opinion, it's not really a one-year thing, right? So committing to a high deductible health plan, in my opinion, is a multi-year strategy or a long-term strategy because of the nature of the HSA. So having an employer that's committed to helping me fund that early and often or annually is really important. Finding a great HSA vendor. So one of the things that I think maybe a lot of employees don't understand most commonly is that many of the HSA vendors that are available to organizations provide things like mutual funds to invest in, so that employees, if they're not utilizing this cash to pay for medical services, typically you have to reach an account minimum. It's, the most common account minimum I've seen is $1,000. So once their account balance reaches $1,000, they can use that money to invest in mutual funds that will pay dividends, which are also tax-free. That way they can set aside this money tax-free, and it's now going to work for them tax-free, and it will continue to be tax-free as long as they're using unqualified medical expenses. Medical dental or vision, I apologize. So yeah, it's really important that you understand what your funding could be, either annually or on a one-time basis, and then finding that HSA vendor that really makes it a worthwhile benefit to offer. And then just if we take a step back, for 2019, the HSA maximum contributions are $3,500 for the individual and $7,000 for family. Keeping in mind that that is the combined contribution maximum between the employer and employee. So it's good to make sure that you communicate that out so that nobody finds themselves in a little bit of a tax issue at the end of the year. All right, so if we jump over to the next slide, we'll cover a few topics in the coming slides. Employee education is super, super important. You know, in the slide that Tracy showed, I think it was 50%, Tracy, or maybe a little bit less, where education was the main factor in people not electing or adopting CDHP. So we're going to talk about a few things that can really help you get that message across. The first being, and you've heard us say this so far, is consider using the term consumer-driven health plan, not high-deductible health plan. My opinion is that high-deductible health plan doesn't really convey a sense of consumers having the power to decide what their healthcare needs are going to be for the coming years. It doesn't sound great. It sounds bad. Marketing is a really powerful tool, so using terminology that will resonate with your employee base is really important in my opinion. What you're really doing when you say it's a consumer-driven health plan is telling them that they have the power to make decisions on for their own healthcare, and kind of also that they've got skin in the game. So now when they seek out care, you know, they're now incentivized, because they have skin in the game, they're incentivized to look for low-cost options. They're incentivized to look for where to get an MRI that will cost, you know, $200 versus $2,400. So that's, I think, marketing and settling on some terminology is really important for your base. Promoting consumerism. So the best part about these plans is that you're not paying for access you're not paying for access to something that you're not utilizing. With a consumer-driven health plan, you're paying for what you consume. And that's it, really. You're not paying for something that's, you know, Cadillac or platinum or gold. You're paying for the cost of care that you require when you require it. One of the other messages that should be considered at any time throughout the process of adopting a CDHP is crafting a message that lets your employees know that you're committed to this model for them by offering that one-time or annual HSA contribution to help them offset their costs, whether that contribution is upfront, biannual, semi-annual, per paycheck. However you decide to fund those HSA accounts for your employees, making sure that they understand that you're committed to helping them do so can really make the difference for them. And then certainly last but not least, HSAs are great for reducing taxable income. They're a great investment vehicle for retirement. I think in one of the next slides you'll hear when we refer to them as a medical 401k plan, which they work in the same fashion. So, you know, helping employees understand the tax benefits of enrolling in an HSA, it's what sold me when I first adopted a consumer-driven health plan. So I think if it will work on me, it will hopefully work on anybody. All right. So now that you've settled on your message, get ahead of open enrollment. One of the first things that I do when I think about bringing a CDHP into an organization is, once I've got my message, how do I get it out there and how do I do it effectively? So one of the first things I do is look at the plan mechanics and the plan design and create a baseline cost analysis for the employees at the single, employee plus spouse, employee plus children, employee plus domestic partner or spouse, or family coverage. It's really important that you give employees a best case and a worst case scenario so that they can make an informed decision on, on their own to understand, well, I don't really use that many medical or that much medical services throughout the year. So, yeah, I could stomach paying $200 to see a doctor because it's only going to happen once a year for me. Or you can say, I'm a family with 2 children and, my kids are accident prone and we've ended up in the hospital a couple of times over the past few years. Creating that baseline cost analysis for them will show them what their best and worst case scenario is going to be within that plan. And then, especially through open enrollment, assuming zero knowledge, so providing them multiple opportunities to learn. So open enrollment benefit workshops, I've done these myself. I've traveled the country, gone to satellite offices, done webinars, Zoom meetings, one-on-ones, office hours, you name it, I've done it, to make sure that I give employees every opportunity to ask the questions that they need to ask so that they feel comfortable in making this decision for themselves. Next slide, if you don't mind.
I got you, Jason.
Sorry, thank you. So
You're welcome.
Hyping the HSA. So I always refer to HSAs as a medical 401k. There's so many similarities with HSAs and 401ks. So the way that they are like medical 401ks is you can dip into them to pay for qualified expenses. The medical 401k part comes in if you decide that you don't really consume a lot of medical care. Dental or vision care would also be covered under an HSA, is that you can take that account with you into retirement. Saving for 401k and saving for retirement is super important, especially nowadays. And so having an additional vehicle for you to set aside money pre-tax is I just personally, I think it's great. So some of the ways that you can communicate this to employees. So triple tax savings is one of my favorite terms to use for HSAs. So triple tax savings, what does that mean? It means it's pre-tax when it comes out of your paycheck. It's pre-tax as long as you use it on a qualified medical expense. And it's pre-tax when it earns money for you. So when you invest it, any dividends that you earn from the mutual funds that you've decided to, or maybe not decided to invest in, will be tax-free all the way through retirement or through, when the account hits zero, or if you decide to at any point close it. Investment opportunities. Make sure that your HSA provider or your HSA administrator doesn't just offer an interest-bearing savings account for these funds, but, let them know what mutual funds are available to them. The carryover rule with HSAs is a huge deal. It's something that a lot of employees that I've talked with get confused, which is understandable. FSA accounts do not carry over. They are forfeit at the end of the year unless you have a specific carryover clause for a particular portion of that FSA account. The HSA never goes away. It is literally their money. It never goes away. It only goes away if they spend it. HSA accounts are governed by the Patriot Act. It is the same as if you walked into any financial institution and opened up a savings account. Your employer has no right to the funds in that account. It's not that it could be forfeited like an FSA or a DC FSA at the end of the year. Portability, you can take this with you. Even if you stay at your employer and you move into a different medical plan, it stays with you. Portability is a huge deal here. In one of the companies I worked for, I had somebody roll over, I think it was a $27,000 HSA account. So they'd been saving for years, which was pretty impressive. So flexible contributions. Many of us know whenever you elect an FSA plan at the beginning of your plan year or as a new hire or during open enrollment, that's the amount that you're stuck with unless you have a life event. With an HSA, you can fund this however you want throughout the year. your employer, you as the employer will set the employer contribution at whatever rate that you want to, and however it pays out is up to you. But employees also get that opportunity. So personally, I fund my HSA in the first 3 months of the year so that I know that if I need medical services, that money's there for me to do it. You can do it evenly over however many pay periods you want. Most administrators that I know of will also allow you to do one-time funding. So you can set up a schedule so that, maybe the first paycheck of the year, you take $500 and drop it in there, but you don't put any more money in it until the following quarter. Always talk to your administrator about what the limitations of their HSA funding is. Because some of them do have a couple of rules around whether or not you can fund one time or not. Annual contribution limits. Make sure you get those out there. Make sure that you're saying, we're going to get, this is your limit, and we're going to give you up to X amount of dollars throughout the year towards this account, which leaves you with the ability to fund it at X rate. And then catch-up contributions. Catch-up contributions are great, and this is where that medical 401k comes in, the terminology comes into play again. If you are or will be 55 at any time during the plan year that your HSA is open, you're eligible to contribute catch-up contributions to your HSA up to $1,000 in additional contributions. So instead of $3,500 for a single, you can do $4,500, and instead of $7,000 per family, you can do $8,000. So that's really important because the flexibility that you get from this following your retirement age is pretty expansive. And what I mean by that is the funds in your HSA remain tax-free provided that you're using them for a qualified medical, dental, or vision expense. But once you hit retirement age, and again, the medical 401k aspect kicks in, you can actually start to take money out of your HSA as income and pay only the income tax on the value that you're taking a distribution on. You're not paying the 20% penalty that you would if you took a distribution early. And then if we jump to the next slide, excuse me. So also hyping the HSA, the qualified medical expense list is surprisingly long. The IRS has an entire publication dedicated to it. There's a link there for you guys. It's IRS publication 502. It's pretty expansive. We won't go into it, but there are some examples on the right-hand side of the screen. One of the things that I typically tell employees when they're like, I don't really know if this is qualified, HSA administrators will often be able to assist employees for that. If you have an advocacy service, they'll be able to help them with that. If you as the administrator or the plan sponsor are really unsure, one of the first questions I always ask myself if I don't really know the answer to something is it FSA eligible? Typically if it's FSA eligible, it's going to be HSA eligible. But there are tons of resources. There's FSA store, HSA store. I'm sure Lumity has a ton of resources for you guys to peruse in order to find out whether something is qualified or not. Plan mechanics, huge opportunity, excuse me, my words failed me. Huge opportunity for you to go over the actual plan mechanics with your employees to make sure that they understand how this is going to actually work. So give them the ups and downs, right? Don't hide anything. Don't give them don't give them the sense that you're trying to kind of dupe them into doing something that they may not agree with or that they may eventually regret. Frame those costs. That's super important when we talked about creating that base cost analysis so they can understand worst and best case scenarios. I wasn't just talking about their out-of-pocket maximum. One of the biggest things that employees don't really take into consideration when they think about their annual healthcare spend is their premium cost. It comes out of our paychecks. We don't really notice it all that often unless the cost of our plan is pretty exorbitant. We don't really notice it. People in consumer-driven health plans will probably notice it less because the costs are relatively lower to have one of these plans. So you are going to pay a higher cost at the point of service. but you're still getting negotiated rates. So what that means to an employee is if they had a traditional copay plan and they went to see a doctor, the insurance company has a negotiated rate with that doctor for that specific service. On a consumer-driven health plan, even though they're responsible for the first X amount or deductible before the plan will start to share costs with them, they're still paying the same rate that the insurance company would have paid as if they were on a traditional copay plan. Hope that makes sense to everybody. There's a lot of confusion around how doctors charge. Talking to the doctor about what a preventive service costs, what this costs, what that costs, helping them understand how doctors will charge them is really important as well. And it's really, really important to make sure that they understand that preventive care is covered at 100%. This is not something that is plan specific. This is a requirement by the Affordable Care Act. And healthcare.gov has a massive list of preventive care services that you can always link your employees to so that they can get an understanding of what they're going to be looking at or what kind of services they can receive for free. One of the other things that I did want to mention about the preventive care, I've seen a lot of resistance in the past about with younger people that are looking to start a family and they want to make sure that they're spending their money in the right way and that they're assuming what their costs are going to be or estimating what their costs could be. One of the most common misconceptions that I see about consumer-driven health plans, especially with new parents or parents with babies, is that, you know, if you go to that healthcare.gov website, there's a whole section on preventive care for children and newborns. And when I say that, what I mean, most importantly, especially for newborns, is the 1 week, 1 month, 2 month, 4 month, 6 month, 9 month, 12, 15, 18 month checkups, and most of their immunizations, if not all of them, I'm pretty sure it's all, those are covered as preventive care. There is an expansive list on healthcare.gov. You guys can feel free to check that out after the webinar is over. Next is providing that preventive medication list from your pharmacy benefit manager. So the preventive medication list is super important because when we talk about framing their costs, they're also responsible for 100% of their prescription benefits until they hit their deductible in that plan as well. That can be really expensive for some people in the beginning of the year if they're on high-cost medications or maintenance medications. So getting them that preventive medication list from your PBM is super important as well. It's just another data point for them to consider, right? It might be that the medication that they're on is covered as preventive medication, and so boom, there you go. You've got another believer in a CDHP. So that's really important. Some considerations. Cash flow, super important. Can they manage to fund their HSA sooner rather than later? Their future medical needs. And then the administration is another piece. So employees are responsible for saving receipts. When you swipe an FSA card, for example, your administrator might say, hey, can you send us a copy of the receipt? We need to verify that this is a qualified purchase. With an HSA, you swipe your card, you keep the receipt, put it in a folder. My strategy is anytime there's an HSA transaction, put a receipt in a folder. At the end of the year, W-2 goes in the same folder. After I file my taxes, copy of that tax return goes in the same folder, and there's my year all locked up, all right? The IRS could potentially audit any employee's HSA account, so that's why saving these receipts is really important. So make sure that you're letting them know that as well. Plan mechanics, continuing up on plan mechanics. So it's really important that they understand that when that plan year starts, they're paying 100% of their costs, medical care, and prescription costs before the plan will kick in. Now, once that deductible is met, you will either have co-insurance where the insurance pays a percentage of the bills and you will then pay a percentage of the bills until you hit your out-of-pocket maximum. Some high deductible plans have higher deductibles and zero co-insurance so that once you hit that co-insurance or once you hit that deductible amount, you pay nothing except for a tiered prescription. So employers have some flexibility in saying, we're going to have a $4,000 deductible. After that $4,000 deductible has been met, you go on a tiered prescription coverage, so 10, 30, 50, model, and there's zero coinsurance after that as long as you stay in network. A lot of high deductible plans will have a deductible, and then the coinsurance will be anywhere between 60 and 90%. And so the employee is responsible for a smaller portion of the bills, which will accumulate to their out-of-pocket maximum or their out-of-pocket limit. Once they hit that out-of-pocket limit, the plan will pay at 100% until the plan year is over. One thing that also is a really good learning tip a communication tip for employees is understanding whether or not the deductibles in your plan are embedded into their out-of-pocket maximum. So just as a quick example, if you have a $1,500 deductible plan, but the out-of-pocket maximum is $3,000, and let's say the coinsurance is 80%. So employee pays $1,500 for first initial costs, then the plan pays 80% of the bills, the employee pays 20% of the bills, up to the $3,000 out-of-pocket maximum. But what you should explain to them is that deductible may be embedded into the $3,000 limit. So essentially they're paying $1,500 up front, and then $1,500 represented by 20% of the rest of their bills until they hit that $3,000 marker. So that's really...
Hey, Jason,
yeah, go ahead.
Sorry, we're not in the same room. We're on opposite coasts, so excuse me for speaking over you. We got a question from the room that I think is relevant to this slide and what you've just spoken to. And just for clarity, there's a question on whether the HSA account can be used to pay towards the deductible.
Sorry, if the HSA can be used to pay what?
To pay a deductible.
Yeah, so the HSA, generally speaking, so I guess high level when we talk about what HSAs pay for, the first thing that I usually tell people is you don't use your HSA to pay for your premiums. So whatever the per paycheck cost is, that's it. That's already pre-tax, so you don't have to pay, you can't really pay for those with your HSA. But your HSA is really designed to pay for any qualified medical, dental, or vision expense that is not covered by your medical, dental, or vision plan. So deductibles, coinsurance, out-of-pocket maximums, braces, orthodontia, contact lenses, glasses, anything that would be typically covered by an FSA, co-payments, prescription needs, anything like that that is typically that will eventually be paid for by your insurance but may not be paid for now is eligible to be paid for by your HSA account.
Thank you, Jason.
Yeah, of course. And I think that's the end of this particular slide. So if we jump to the next one.
Yeah, I seem to be, there we go.
Yeah, no worries. So continuing year round, continue to educate your incoming staff. So I've spent the better part of maybe a month or two in the last year creating employee-based benefits orientation slide decks that are, I hope that they are the most informative that they could be, while also allowing enough wiggle room for an employee to go and do some investigating on their own. Creating a knowledge base is super important. I will name drop here a little bit. I apologize in advance. I've worked with many companies that have had Confluence as kind of a team knowledge base center, and I've utilized that technology to create a knowledge base for benefits related content so that the entire organization has access to it. And then sending employee tips and reminders. So coming up with a benefits communication reminder plan. So whether it's sending HSA tips, at some point throughout the year. And one of the ways that you can do this is working with your broker when you start to look at your experience in your medical plans. And, if you start to see that, people aren't seeking preventative care in the first 3 months of the year, it might incentivize you to send out, hey, don't forget to go get your annual checkups. You could send that out in March, April, whenever you realize that people aren't utilizing that. Second to that, collaborating with your broker, your advisor, even a company like Lumity, they provide a lot of employee education and plan decision guidance for employees. That's a really good way to stay on top of things. Giving them that option to do that is really important. Employee tips and reminders. So there are a few things that I always tell people, especially when they enroll in a consumer-driven health plan. Always ask, are you in network? if you're not asking the doctor and you need to find a doctor and you're using your insurance carrier's website, mobile app, whatever it may be, make sure that they're in network. Many, many doctors will say that they accept your insurance, but that doesn't mean that they're in the network. And what I mean by that is, and this is a pro tip for any benefit professionals in the room, if employees come to you and say, I got a bill from my doctor, I thought they were in network, why isn't my doctor in network? If you don't already know, doctors are actually the ones responsible for making the decision as to whether or not they're going to participate in an insurance carrier's network. If they don't particularly agree with the negotiated rate, they may choose to not be a part of that network. And that is a doctor's decision. But make sure that your employees feel empowered to ask, are you in network? Or find that out first before they actually receive services. Because if they start to go out of network, or if they are on a plan with no out-of-network coverage, those costs can really spiral for that employee. Negotiated rates can vary by plan. This is really important as well. These aren't always published or available to employees, but they should feel empowered to ask their doctor or contact the billing office at their doctor's office to say, what is this service going to cost me? Obviously, if there's an emergency situation, they should seek out the care that they need in the moment, but employees should feel empowered. They have skin in the game. This is their money that they're using to pay for these medical services at point of service. And so feeling empowered to ask, what is this going to cost me? I have a high deductible plan. What is the rate for this? They're totally within their right to do that. There are also a lot of services that are available to them through the actual carrier. So some carriers have cost estimation tools where they can say, I need an MRI. Here's my zip code. Where can I get this MRI at the lowest cost? And do it that way. So there are multiple options available to employees. Sorry. Yeah, sorry, go ahead.
Hey, I was just going to jump in here, Jason. I'm just getting a time check because I know we have a lot of wonderful material. So yep. I want to make sure we have time for your real story.
Yeah.
So if you don't mind, I'm gonna pull you forward.
I just so everybody on the call, I did warn them that I can talk about this forever. So driving adoption. So year-over-year plan shifts just by educating. For example, previous employer, we had 2 high deductible plans and a traditional copay plan. And the first year that I joined this company, 40% of our population were in the consumer-driven health plan. The other 60 were in the 40% were in the consumer-driven health plan. The other 60% of the population were in the traditional copay plan when I joined. The year after I joined, just by educating, I saw a complete reversal of our statistics. So 60% were now high deductible and 40% were traditional copay plan. And the year that I left this organization, we had increased CDHP adoption by an additional, I think 5 to 10%. It ended up being 7%. So 67% of the organization was in a consumer-driven health plan. So educating is the key. I often say that benefits is a very dry content subject. So we got to try and figure out ways to make it really engaging and fun for the employee to learn. Employee funding strategy for an HSA and a 401k. When you fund HSAs and when you fund 401ks, understanding what these overhead costs are going to be for your organization and what you're currently offering them can really help you understand whether or not it's the right time for your organization or whether you think adoption rates are going to be relatively low. If your organization doesn't offer a 401k match, an HSA isn't the answer to that, but it's a great alternative because you're investing in their future when you make those annual contributions. The annual employer contribution model to HSA. So first, try to figure out what makes most sense to your company and your budget. I think on average, we tend to see $500 for an individual, $1,000 for family level coverage in HSA contributions. Some employers who are trying to stay ahead of the market or even drive down their overall increase will incentivize employees by offering more. Do what works for you and what you think works for your employee base. So doing so will help alleviate the employee worries over the rising cost of healthcare, right? So if you're making this annual contribution, when you see a 5% increase year over year over year, I think in the Northeast on average, we're around 10% on average. Our costs are going up year over year. Doing this annually puts employees a little bit more at ease. And if you commit to funding, employees trend to committing towards the CDHP. Like I said earlier, this is a multi-year strategy, if not, adopting early and then taking it all the way through to retirement. This could be potentially life-changing account and supplement to somebody's 401k or other retirement vehicles. Next, please.
So I'm gonna, I heard from the group that the results didn't show from poll 1, and I wanted to see if I could share those before we do the next. Okay, so I just wanted to be able to share with the room when I took the pulse of the room about HSAs before Jason talked with us. We were coming in at like 35% as super advocates, 44% that agreed HSAs were a great strategy, and 23% were on the fence. So I'm actually going to relaunch the same question because I kind of want to do this Oxford style and see if we had the opportunity to shift opinions in the room. So poll the same question, poll going again. And I'll give this just a few seconds for folks, and then we will be jumping forward to the HSA FAQs. Hey, this is great. So, Jason, you've changed the minds in the room.
Awesome.
Okay, we're going to end the polling there. We've got 51% that are now enthusiasts. So I'm going to stop sharing these results, and let's move to the FAQs. And I apologize if I'm going to move along at a quick pace here with you, Jason, but certainly we'll be sharing the slide deck with folks that are participants, and there's some resources with links to the questions and answers today to make sure that you get everything that you were expecting. So here we go. Jason, what happens to my HSA if I change plan years next year?
Most common question I get. If you decide that an HSA eligible plan is not for you and you move to a traditional copay plan in the following year, your HSA, like I said before, and I'll say it again until I'm blue in the face, that is your money. You can no longer contribute to that HSA because you're no longer in a qualified plan, but you can still use it to pay for medical services that you receive in your new traditional copay plan until you either exhaust the funds or you just let them sit there until you want to use them again.
So let's see if I can, sorry, I'm not advancing. Here we go. You know, when you're in a hurry, things slow down. Okay, what happens to my HSA when I leave my job?
Next most common question. It's your money. Again, I'll say it again. It is your money. If your employer has made a contribution to this HSA, it's also your money. You own the account, so much so that if you decided, and one of my favorite little funny things to say, this is so much your money that if you walked into Best Buy and used your HSA card to buy a big screen TV, it would pass. The thing that you really need to consider, especially for your employee population, if they misuse these HSA funds, anything that's not qualified expenses, they have to declare as taxable income. So it is your money. That being said, if your employer is sponsoring your HSA account now and they're paying the administrative fees for maintaining that account, once you leave, the administrator will likely charge your account for those admin fees.
So what about having an HSA and FSA in the same year?
Also a good question. So yes and no. So what's not allowed is for you to have a general purpose health FSA the same year that you've had an HSA for overlapping months. If you switch jobs or you have a life change event, there are a couple of things that you need to consider. Your spouse cannot have you or your spouse cannot have a general purpose FSA or an HSA at the same time either. So if they're a tax dependent and they're on your medical plan and you file taxes together, consider your talking to your tax professional, because you want to make sure that you're not breaking any of those rules. What is allowed is what's called the limited purpose FSA, often referred to as a combo flex FSA. These are specific limited purpose FSA accounts that are only to be used if you are enrolled in a health savings account, which allows you to pay for eligible dental and vision expenses throughout the plan year. The real goal behind this is to make sure that if you realize there are so many cases where this would become relevant. If you know that you have a lot of dental expenses in the upcoming year, you could max out this FSA to pay for that so that you're not using your HSA dollars, because those roll over year to year. The limited purpose doesn't roll over. Same thing goes for vision, or for example, if you have family level coverage and you know that little Johnny is accident prone and you're concerned about potential medical costs, you can use this to pay for braces, for orthodontia, for general dentistry, or vision expenses that you have. That's really important, and it's additional money that you can set aside tax-free on an annual basis. Dependent care FSA. What's really important about this, dependent care FSA accounts are not driven by your plan choice. So there's no eligibility requirements. You don't even have to elect a medical plan with your employer to enroll in a DC FSA if they offer it. This is specifically used to pay for eligible dependent, elder, or child care expenses. Children have to be 13 or under in this case. And for dependent care, if it's mom or dad or an aunt or an uncle, as long as they're a tax dependent as defined by the IRS, you can use this to pay for services that you require to care for the elderly or your children. So a couple of cautionary things. If you want to switch from a general purpose FSA to an HSA, make sure you don't get tripped up by an FSA carryover or grace period. What this means is if you have that general purpose healthcare FSA and your administrator allows for $500 to roll over into the next plan year, contact your administrator first before you do anything to understand what their carryover rules are. My particular administrator allows so that if last year had a healthcare FSA account and they're switching to an HSA plus a limited purpose FSA account for this plan year, if that were to roll over into the following plan year without the right rules set up, that $500 could be forfeit, right? Because they're no longer on an eligible medical plan. That being said, my particular administrator allows that if they elect a limited purpose FSA account, that $500 rollover will follow the right or the eligible type of FSA based on their medical plan. So in that employee's case, the $500 wouldn't go into a general purpose FSA. It would automatically be carried over into that limited purpose FSA. But these are things that you always want to make sure that you're asking your administrator whether or not you have the ability to do this.
So I'm actually going to pass over this question, the eligibility rules. We have them here, so you can reference them. A question about paying for families' expenses.
Yep. So in addition to your spouse, you can spend your HSA dollars on children or any other dependents that you claim on your federal tax return. You can pay for spousal and dependent expenses if they're not covered on your health plan as well. One note that's really important, while the Affordable Care Act allows for your child on your health plan until they turn 26, this is not the same thing as being a tax dependent. So that doesn't automatically mean that because they're on your medical plan that they can be covered by your HSA. If they're eligible to have an HSA on their own, it's likely that they'll have to do that.
Great, thanks. Okay, we get this question a lot. What about HSA funds being spent on a domestic partner?
Yeah, so unfortunately, no, not unless that domestic partner is claimed as a tax dependent on your tax returns. That being said, if they're not qualified to be covered by your HSA, because they have that qualifying medical plan, they can go open up their own HSA, and you can both actually receive taxable benefits by setting aside that money on a pre-tax basis to cover your medical expenses. I'm
going to move past this one. There's not a minimum amount, but there is a maximum. This is a very hot question. When do my employer contributions kick in?
Yeah. So that's always going to be at your employer's discretion. It depends on how you as the employer set up those contributions. If they do per paycheck, per month, semi-annually, or upfront annually on the first day of the year. It all depends, but you should always consult with your administrator.
Hey, Jason, I am going to insert a question that came from an attendee
Sure.
because it's regarding COBRA and whether HSA funds can be used to pay the insurance premium.
Yes, so that's actually a really fantastic question. So COBRA premiums are really the only caveat to the HSA paid for premiums rule that exists. If you are continuing coverage through COBRA, you can use your HSA account to pay for those COBRA premiums.
Another question, is the total contribution I elected available at the start of the year?
Got it. So yeah, that's also another fantastic question. HSAs and dependent care FSAs, you must build the balance in your account before you can make claims against it. All right, FSA accounts, the regular FSA and the limited purpose FSA, those are fully front loaded. Whatever your election is for the year, that's what's available to you at the beginning of the plan year. The best part about HSA accounts is, let's say you're putting in $50 a paycheck and it's the end of January and you have a $200 bill that you need to pay, but you've only got $100 in your HSA. And this is why when we talk about considering cash flow, if you can afford to put that $200 on a regular credit card or pay it out of pocket, you can do that. And then when your HSA account reaches $200, you just pay yourself back. A lot of administrators have an option to set up direct deposit in their mobile app, so you can pay yourself back directly from your phone, or they can send you a check, or however, I mean, so many, technology is advancing so fast, there are so many different ways you can do that.
How about, can I change my contribution amount anytime during the year?
Yeah, so that's one of the great flexibilities of it. If like I said, I front load and fund my HSA in the first 3 months of the year. If I have one particular paycheck where I know I'm going to need money to, fix my motorcycle, I can cancel that HSA contribution and then defer it to another pay period. So yeah, you can change it at any time. So this is a great question.
Yep. And so just to do a time check here, we are getting close to the end of the hour. So yep. I'm going to, I think it's important to speak, to just point out this last month rule. And I'm going to jump forward to what if I use funds on a non-qualified expense, because we have got some questions from the room specifically about once you turn age 65. Yep.
Yeah, so once you turn age 65, you can take distributions from your HSA as income without the 20% penalty. I'll refer back to my little quip about buying a TV with my HSA card. If I use my HSA to pay for a TV, I'm going to pay income tax on the amount that I took out plus a 20% penalty. Once I turn 65, if I take a distribution from HSA as income or just cash to spend, I pay income tax on the value, but not the 20% penalty.
And then how does an HSA affect my income taxes? I am actually going to move forward because these are going to be posted for the room. And state income taxes, it sometimes applies. What if I exceed the annual contribution limit? Excess funds are taxable is the short answer. This is a question that comes up a lot, Jason. If I don't have funds available, can I reimburse myself later?
Yep, so I think we covered that in one of the previous questions. If you pay out of pocket, you can always pay yourself back.
And then you hit on this as well regarding keep your receipts with your tax records.
Yep.
This one's a good one to speak to. Does my HSA align with my plan year? Because there's a lot of employee confusion for off-cycle years.
Yep. So one of the first things I would say is no, it doesn't align with your plan year. HSAs are aligned to January 1 to December 31 or the fiscal calendar year. If you're looking at adding a consumer-driven health plan with HSA attached to your benefits offering, I would highly recommend realigning your renewal date to 1/1 for the beginning of the year, just to make it easier for everybody.
I'm going to move forward in some of these.
Sure.
Technically, you can have more than one HSA account, but why would you? It's easier to manage if you have one. This one is something that really trips up employees. I got a check from my HSA administrator. Should I cash it? I'm going to just jump in and say no, and I'll let you guys refer to why this happens later. Jason, I'm going to move forward and just kind of point out some of the references that are available. Yep. I know we're getting close. Guys, I'm actually not going to speak to these. I just want to let you know that these will be available. Some of the bonus materials, we are loading you up with things to just help you. The HSA playbook goes over, dimensions a lot of what Jason spoke about your plan design. The HSA 101, it's actually a PowerPoint you can download and use for educating your employees. And then all of the questions that Jason talked to today, the top 20 are on this HSA FAQs webpage. We are going to be looking through some of that came through the room and growing, so it'll be beyond 20 shortly. If we didn't have time to get to any of your questions today, we're going to reach out to you directly. We can email you. I do want to let you know that if you are interested in getting a complimentary benchmark analysis on your plan design, please reach out to benefits@lumity.com. If this was helpful, would love for you to follow us on LinkedIn, follow Jason, follow me, follow Lumity. I absolutely want to thank you, Jason, for your time today, and I love that you can talk about HSAs all day, and I feel so bad about rushing you through this.
No, it's totally fine. I was aware that I was going to do this, I think.
So there's a brief survey for attendees when you exit. Please rate the speakers. Let us know what's interesting to you for future webinars. And as a reminder, watch for an email in the next few days with your SHRM participation code. Thank you for spending time with us today. We really appreciate it. That's a wrap.
Thanks, everyone.